All right, Michael, we are good to go.
Good morning and welcome, and thank you all for joining us today. Buenos dias a todos y a todas. The Inter-American Dialogue is very pleased to host this important and very timely discussion on data-driven healthcare practices in Latin America and the Caribbean. The onset of COVID-19 pandemic has revealed longstanding deficiencies in how health information is obtained, shared, and utilized, especially in Latin America and the Caribbean, a region that has been disproportionately affected by the outbreak. 2 months ago, a special dialogue task force issued a white paper, Deepening Cooperation and Coordination on Health Policy in the Americas, a new approach to health emergencies. The effort was co-chaired by Drs. Julio Frank and Dr. Helene Gale, and directed by Beatriz Londoño, Colombia's former Minister of Health. It included diverse and influential members from throughout the Americas. One important point the report made was that the pandemic clearly shows the importance of reliable, comparable, timely, open, and disaggregated data and statistics to tackle health crises efficiently and effectively. The report recommends increased sharing of timely data in all public health scenarios, not just emergencies or high priority threats, while at the same time emphasizing the importance of consumer privacy and government accountability. Today, our panelists will discuss the challenges and opportunities surrounding data-driven healthcare in the region and the lessons that have been taught by COVID-19 and what the potential costs are of transforming the region's health systems into more data-driven care models. I'm delighted to introduce our moderator for this session, who will also frame the topic, Adrian Scheid, who's the Principal International Policy Advisor at Arnold & Porter and formerly served as Senior Vice President for International Relations at United Health Group. A very impressive bio, as well as those of other speakers, are available on our website. We are also very proud that early on in her distinguished career, Adrian worked at the Dialogue. Adrian will be introducing our excellent speakers, but I want to personally express my appreciation to the three of them for their participation in today's event. At the end of our panel discussion today, we hope to hear from our participants with your questions. Please submit questions using either the Q&A function in Zoom or by emailing meetings@thedialogue.org. I want to remind all of you that interpretation to Spanish is available for those joining via Zoom. Please click the interpretation button at the black bar at the bottom of your screen and select your preferred language. As always, we extend our profound gratitude to our corporate program members. Their important support and their engagement make these exchanges possible. Before turning it over to Adrian, I want to thank and recognize Eric Brand, who directs the corporate program and publishes our Latin American advisor, which is a wonderful resource and the Dialogue's main communication vehicle to the corporate community. I also want to express my gratitude to Kate Blanchett for her great work and support in organizing this event. And with that, let me turn it over to Adrian.
Good morning, and thank you, Michael, for that overview and for your introduction. I really appreciate the opportunity to moderate this important and timely session. As Michael mentioned, we have an impressive array of speakers this morning to help us understand the challenges and opportunities surrounding data-driven healthcare in the region. Charles Dalton is a senior health specialist at the World Bank Group's International Finance Corporation, where he is responsible for providing advice to inform and shape the IFC's health investment strategy and programs. With 30 years of experience in public, private, and health insurance settings, Charles has extensive emerging markets knowledge and brings a practical understanding of the challenges facing health systems and the opportunities presented for relevant and sustainable public-private collaboration. Maria Clara Horsburgh is a medical doctor with specialized training in both medical oncology and palliative care. Maria Clara currently heads medical affairs for Roche Central America and the Caribbean, where she emphasizes scientific excellence and multi-sectoral collaboration to build health systems focused on patients and personalized healthcare. And finally, Miguel Coelho is responsible for sales and business development of Oracle's Healthcare Global Business Unit into the EMEA and Latin American markets, helping customers and partners in countries throughout the regions to digitize the healthcare ecosystem. A software and computer engineer by training, his focus is on healthcare IT with a concentration on healthcare interoperability, health information exchanges, and healthcare analytics. Thanks to all of you for joining us today. So this is meant to be a true dialogue. And rather than having each speaker make formal remarks, I'm going to get us started by asking each of our experts a series of questions. But as Michael mentioned, we're also going to be saving plenty of time for your questions. So I encourage everyone to submit them using the Q&A function in Zoom or by emailing meetings@thedialogue.org. As the report mentioned, the COVID-19 pandemic has exposed many of the deficiencies in how health data is obtained, shared, and utilized in Latin America and the Caribbean. Charles, I'd like to get started with you. Can you share with us your perspective on the lessons the pandemic has taught us about the state of data-driven healthcare in Latin America and the Caribbean, and where is it headed?
Yes, sure. And thank you very much for welcoming me, for allowing me to participate. And I apologize to you all if I use my hands. I tend to do that. I tend to do that a lot. Look, I think what we're seeing in the region aligns to what we're seeing globally. We're seeing that, unfortunately, there are silos and lots of silos of data. We're seeing the public sector with data, we're seeing the private sector with data, but we are beginning to see a sort of a realization that there needs to be more sharing of data. We're seeing the evolution of purchasers and working more closely with providers. And to be able to do that, you need to have good access to data. You need to be able to interpret that data, utilize that data. So there are a couple of examples. I mean, if we look at Brazil, for example, we've seen a big shift in Brazil in terms of the purchasing and providing arrangements within the private healthcare sector. And again, data is being heavily now utilized to look at population, to look at disease, et cetera, to try and identify how more value can be driven throughout the system, but to get better outcomes as well. So I think what we're seeing aligns to the global move towards better understanding of data, better sharing of data, better utilization of data. But we have a challenge. We have all of these silos. And the question is, how do we break down these silos? And at the same time, we also have this digital health transformation that is now happening, that was happening prior to COVID, but has now sort of taken off during and post-COVID. And we also need to be very mindful that with this digital health explosion, we don't create more silos. We run the risk of knee-jerk reaction to digital health and not sustained careful planning and system thinking implementation of digital health, which will undermine the utilization of data to the way we want it to be utilized. Thank you.
Thank you. Can you tell us, why is it important to make healthcare decisions based on data? And does data-driven healthcare really have the potential to improve patients' lives without increasing costs to society?
Look, I think that it's a really good question, and we could talk all day. I mean, I think the benefits that I see and we see in our work is that with digital health, with more data utilization, it's going to help us in this move, if I can call it, and I'm just going to use the terminology to sort of value-based care. It's also can be used to get better high quality assessment and better outcomes, as I've said, and used correctly, it can also help us analyze and plan accordingly for population and sort of disease management. So I'm going to give you the benefits, but I'm going to make it very clear. Implementation and realization is not going to be easy. And I've already touched on what's happening in Brazil with the move towards this value-based thinking, new purchasing models, more performance incentivization, and more data analytics. And what we're learning in Brazil in the private sector can be equally applied in the public sector as well. How do we strengthen social health insurance systems? How do we enable social health insurance systems to get the right benefit design, the right tariff design, and to also understand where the key demand and the key risk issues lie? So ongoing data analytics will help us understand population. So we're witnessing sort of many countries' greater collaboration, as I said earlier, between the purchasers and the providers, to look at those demand trends, to look at the disease profile, and to encouraging the providers of care to maybe share risk with the insurers of care as well. So better understanding of those disease patterns, particularly around NCDs. So we're going to see this escalation, this continued escalation in the majority of the markets around NCDs. So what this requires is to understand where the data sits and how it can be shared. So for example, the electronic health record, is it shared between, can it be easily shared between clinicians? Can they look at it? Can they interpret it? Can they share knowledge? And can they utilize that better for sort of managing the patient requirements, managing the trends, allocating the right personnel, the right resources to address the issues that they see? And also, we can also see with healthcare analytics, it provides new ways of doing it. So are we treating the care correctly? Sorry, are we treating the patient correctly? Are we appropriately lining up the right resources in the right place at the right time? So again, we anticipate this sort of trend to continue. I'm making it sound easy, and I really want to emphasize the fact that implementation is going to be very difficult. And linked to that, we also have the ability for predictive analytics. So how do we cut the cost, improve the quality, and improve the outcome as well? So again, using this predictive analytics in the data to preempt, but also to understand the trends, which can then be used for negotiating, as I've said, on the service side, but also working across with the pharmaceutical side as well, and saying, what are the disease patterns? What are the drugs we actually need to solve these issues that we're facing in particular countries? So it's all about sort of the health outcomes. I think also what data allows us to do is look beyond traditional healthcare data and understand patient habits, behaviors, social economic factors like employment and education, and also the physical environment is what's impacting on the population, what's impacting on the rise of certain diseases in certain areas. And I think that's fundamental for government. And another question we've often asking is, are governments collecting all of the data? So they're collecting data from within the public sector. Are they able to access the data that sits in the private sector? And are they then able to look at it holistically? And I'm not sure in all countries, all data is being collected equally, if I can call it that. So that's another challenge that needs to be understood. Thank you.
Thank you. So you talked a little bit about some of the progress that's been made, some of the challenges that the region faced already in your remarks. But just to wrap us up, from your perspective, are Latin American countries ready to implement personalized data-based healthcare?
I think so. I mean, it varies on the country. And let's be honest, each country has a different level of sophistication. So we have sophisticated markets like Brazil, but then as we move towards other countries, they're not as sophisticated. So we have to be aware of the challenges around digital health. So for example, the siloing. I mean, it's a major problem. The interoperability, the comparison of data, the change management required to implement data. So I think everybody has to look at where do we sit in the maturity of our market, where do we sit with the maturity of our, if I can call it, business model? And so are we in a position to share data? So, you know, sharing is caring, but the health sector is notorious for creating data silos. And we need to be also aware, is the digital health going to create more silos? Is there a risk to creating more silos? So it's, how do we set up our business models to embrace digitization, to embrace the utilization of data, and to embed it as a fundamental building block, if I can call it that, of day-to-day business? We can't have it sitting outside. We need to place it firmly within the middle of public sector systems, and also firmly in the middle of private healthcare systems as well. So we make the right decisions, the right choices about the investments we make in digital health. Because I think many of us will agree, currently there's a lot of hype about digital health, and a concern for us is the wrong decisions could be made about investing in digital health because a system view is not being taken. And so I think for us, that's a sort of a key thing. And a learning point for me, 25 years ago, I remember sitting in front, and this was not in South America, but it was in the UK. And I sat in front of an IT director in one of the leading teaching hospitals in the UK. And this is 25 years ago. And at that point, he had 25 independent systems that weren't talking to each other. So hopefully we've moved on. But again, with this digital health, do we face the same problems? So we need to be mindful of, where are we today? What is it we want to do with digital health? What is it we want to do with data? And then plan accordingly and strengthen our systems from a people, process, and technology perspective. We mustn't fall into the trap of thinking technology is going to solve all the problems. There's a massive people and process angle as well to realize the full benefit. So again, the maturity of different markets is huge across South America and the Caribbean, and each market is going to have to figure out, where are we today, where do we want to be, and how do we get there? Thank you.
Thank you very much, Charles, for your insightful comments. A key aspect of data management is privacy and the protection of personal data. Maria Clara, I'd like to turn to you now to talk about this topic. How will the increased emphasis on patient privacy and data protection shape the adoption of digital health going forward?
Thank you, Adrian. And I take the opportunity to thank you for the invitation. I'm very excited to be here talking about this very important topic. So, data privacy and being able to guarantee that privacy to patients is key, and that's a non-negotiable. But in order to realize the full potential of using data, of leveraging data, policies and laws must make it possible that we can use that data, and most importantly, share that data, as Charles just mentioned. Today, most mechanisms are through informed consent, but there is uncertainty as to how and when we can use that data. So there is a huge opportunity to improve laws and policies in order to allow for the use and sharing of data. Only through this can we realize the full potential, both at an individual patient level, but also for other very positive benefits, such as, for instance, research and development. The development of new medicines and new technologies or testing solutions can benefit from clinical genomic databases, and especially in certain conditions such as rare diseases, sharing of data is vital. So as a conclusion, data privacy for individual patients must be guaranteed, but we must evolve policy-wise so that data can be used and shared for these both patient research and also societal and healthcare system benefits.
Thank you very much. While many providers have started collecting multiple forms of data, it's often underutilized. What are the real benefits of data analytics for the purchase and provision of health services?
Yes, and that's very interesting. And it's also related to what Charles mentioned. Data are, in fact, underutilized. And this is due to data being in silos, as he explained before, but also because it's usually unstructured and not interconnected and not interoperable. So again, if those basic obstacles are not solved, it won't be possible to realize the full potential of data. I forgot the question, sorry.
So the real benefits of data analytics for the purchase and provision of health services.
Yeah, thank you. And again, Charles mentioned value-based healthcare. So the traditional ways of acquiring medicines and innovation is through volume. Like if you buy large volumes, you get certain discounts, but that is a very limited approach. Today, we really must pay for value. So what value a certain medicine brings to individual patients in terms of prolonging life or quality of life, or allowing the patient to stay healthier for longer, or to go back to society and play a useful role in society, be it taking care of family or working. Value-based healthcare takes that into account, and it also uses what we call real-world data. Real-world data talks about the real performance of a medicine in the real population and not in the selected populations of clinical trials. So this sort of use of data allows for innovative negotiations. For example, risk sharing. So using of data, especially real-world data, allows for these innovative negotiating models. On the other hand, and more at an individual level, I'm an oncologist, so I'm going to talk about oncology. We have increasingly available genomic sequencing of tumors. So through that, we can anticipate in many cases which medicines are going to be more useful in a patient, and we can avoid administering drugs that will not be beneficial for a patient. So that is another very valuable way of investing adequately, of investing in what will really bring a benefit to patients.
Thank you very much. Both you and Charles have talked a bit about the positive impact that data can have on the healthcare system, and also mentioned, that's fraught with some potential challenges. Can you, to wrap up, dig a little bit deeper into what you see as the largest challenges in collecting, analyzing, and using healthcare data correctly?
Yes. So I believe the greatest challenges lie in data generation and data acquisition, and this is very much related to what we said before. If different institutions have different systems and they're not interoperable, well, that's a barrier. And the other barrier, and Charles mentioned it, is barriers to data sharing. As I mentioned before, there are certain situations in which an institution's data is enough and is okay for administrative purposes, for example. But the full benefits lie in sharing data and in the use of big data. This allows not just for descriptive analytics, but as he mentioned, for predictive analytics and even for prescriptive analytics, software and programs that may even suggest what to do next. So anyway, there is a tool, I don't know if you've heard about the personalized healthcare index developed by Future Proofing Healthcare. This is a wonderful tool because it mapped several indicators of 10 different countries in Latin America indicators that refer to this use of technology and data in healthcare. So there it is very interesting because you can see how individual countries are doing, and you see where countries are doing better and other countries may learn from them even, and where countries have opportunities to do better. And so this tools allows for identifying those barriers, those gaps, and it is a very good starting point for conversations based on evidence to continue this journey towards data-driven healthcare, personalized healthcare.
So I'd like to go back to you and ask you the same question that I asked Charles, which, from your perspective, are Latin American and Caribbean countries ready to implement personalized data-based healthcare?
I think it's very important to note that data-driven or personalized healthcare is not a thing of the future, but it's using all this data and technology for the better care of health, both at an individual level and at a healthcare systems level. So I do believe they are ready because they have already taken these first steps. Again, the index is very valuable to identify where countries are more robust and where there is still some way to go. So in general, in the region, the adoption of what they call personalized technology is quite good. And this refers to the use of wearables, apps, platforms. That's quite good in the region, as well as electronic health records. There are several countries that have a widespread use of electronic health records, such as Uruguay, Costa Rica. But then again, there are opportunities to improve. So yes, I believe the region is ready. It's already given its first steps, and in many cases, even more. But there is still a lot to do, and there is a lot to do. And so no one sector can do it alone. It is very important that we join forces. Michael mentioned the private sector, but it's private sector, public sector, academia. We have to listen to the voice of the patient. So it's time to get all together with one common purpose, with one common goal, and start these conversations to continue on this journey towards building more sustainable and resilient healthcare systems that bring better outcomes for patients.
Thank you very much. And just really quickly, any final words you want to share about lessons that the pandemic has taught us about the state of data-driven healthcare?
So a lot has been mentioned. So the pandemic has exposed many gaps in access, in infrastructure, especially talking about technology and data. But I believe what is very important that the pandemic taught us is the importance of using data and technology. Those tracking and tracing systems that allow for better management of the outbursts of the COVID. Also, the scientists in China who sequenced the viral genome early on and shared it with the rest of the scientific community and enabled the early development of testing and eventually vaccines. So I think it's important that the pandemic highlighted the importance of using data, taking decisions based on data, and embracing and leveraging technology.
Great, thank you very much. Appreciate your comments. Michael mentioned in his introduction that it has become increasingly apparent during the pandemic that having reliable, comparable, timely, open, and disaggregated data and statistics is essential to managing and responding to health emergencies. And having relevant data makes health systems more resilient, ensuring they're better able to respond to the next crisis or even predict it before it happens. I'd like to ask Miguel if you could help us explore this further. How can better uses of data prepare health systems in the region for future crises, as well as improve the delivery of care under more typical circumstances?
All right, very well. Well, first of all, good morning. Buenos dias a todos. Bom dia a todos. Many thanks for the invite from the Inter-American Dialogue. Very glad to be here. Well, we sort of risk sounding like a broken record because we're all making a point on more or less the same things. Well, first of all, of course, availability of data, and I think it's always implied, but let's be very clear. Ideally, electronic data, right? Because data can be on paper as well. And breaking of silos and sharing of data is definitely the way to make best use of data. But what did we see during this pandemic? And we're talking here about Latin America and the Caribbean, but I would say the whole Western Hemisphere. I don't have so much visibility about Asia Pacific, but I would guess the same. Perhaps in Latin America and Caribbean, maybe there's a slightly worse situation due to a lower penetration of electronic medical records in the different health facilities. But basically, there were no ability to react to a situation of this kind. So the data was, and Charles and Maria Clara mentioned it, data was scattered and in silos. It was sometimes non-existent data. And sometimes it was not, and very often it's not electronic data. So in many countries, Western countries even, with good infrastructure even, there was still a lot of paper going around and many faxes being sent still, right? And this lack of data led to very disparate reactions, typically based on either political reasons or beliefs, and not really informed decisions based on science, and also allowing for some disinformation to spread. So we've seen situations, for example, for vaccination drives, the difficulty in identifying the relevant cohorts, the groups of people that should be prioritized. It was relatively easy, so most systems could, prioritize people by age. But even sometimes, just finding out all the health professionals, those that should, immediately be prioritized for vaccination, sometimes it was quite difficult from what we could see. Perhaps the doctors were easy, so those that are credentialed were easier to identify and group, but other supporting roles in hospitals and care homes were more difficult. And then the lack of social data, for example, as well, which was more and more we need to think about this integration of healthcare and social data that is extremely useful for this kind of situation. So, for example, to identify certain spots that may be at a greater risk, certain normal citizens that actually care for others in need and therefore should be prioritized, and of course, people with certain underlying conditions. So, without enough and good data, the traditional disease surveillance processes that were, in place to deal with smaller, let's say, not so wide-ranging events, well, they often collapsed. But I think there were also good uses of data and, that could prove and hopefully will stay for the future. And those, I think, are better good examples of better use of data. For example, the clinical trial data that was collected for the fast tracking of the vaccine was amazing, right? We had some vaccines with 40,000 volunteers. All respect goes to these people that volunteered for this. It's an impressive act of altruism, and there was so much data that was able to inform these decisions to, okay, let's do this, let's release these vaccines for the general public and get this pandemic finally a bit under control. Or another good example, so a simple solution that we've developed for the Centers for Disease Control in the US, called vSafe. It's a simple application or site where the citizen, him or herself, can report adverse effects of the vaccine. So we sort of cut the middleman, right? Instead of reporting it to your doctor, your pharmacist, you actually report it directly. And after a while, there were 10 million people registered, sometimes reporting, important adverse events, but sometimes reporting, normal effects. And the application also had, reminders were sent, to check in the next day and say, hey, how are things going? Did you improve? Are the effects getting worse, and so on? So a very simple thing to just nudge people and to obtain data, to obtain what we could call real world evidence very easily was extremely important. And perhaps one interesting piece of data about this was that the data collected in vSafe actually allowed some researchers now to come to the conclusion that the vaccines are actually safe for pregnant women, because that was obviously a cohort that was not participating in the original clinical trials, the initial clinical trials. But many women did take the vaccine, either not knowing that they were pregnant or knowing, and they decided to do it. And this allowed for the collection of an impressive amount of data that proves that, yeah, indeed the vaccines are safe for pregnant women. So I think as I said, some of these things will hopefully stay after this crisis, and will also not only help in situations of crisis, but also on the day-to-day care.
Thank you very much. Can I have you talk a little bit about the potential costs of transforming the region's health systems into more data-driven care models, and what benefits can realistically be expected that could offset those investments?
Well, I think investments is the specialty of Charles, but let me try and point some areas here. So very clearly, investment is necessary, is very much needed. One issue that investment in IT and information systems always has to face is it's hard to compete with other very pressing needs in the health systems, right? So the budget for this kind of solutions that allow for the aggregation of data, for the sharing of data, for the analysis of data, for helping with decisions, they have to compete with other needs, such as we need a new machine for the radiology department, right? We need more staff, we need a new ward, we need these materials or those medications, and it's always that. But investment is needed at several levels. The infrastructure that allows this data to flow, right, is one aspect. I'm hopeful that as the mobile networks develop, even more remote sites will be able to, for example, share data, contribute with data, access data, and be more connected. And there are still many remote sites and care facilities in the Latin American Caribbean region, so that they can benefit from the richness of this data. Then, of course, there's investment needed in the let's say more central systems that will collect, aggregate, organize, allow for the analysis of that data. And then, of course, the edge systems, right? So the solutions, the electronic medical records, the EHRs that will need to be ideally in each facility, that will allow for the collection of data and also for the consumption of some of that data. But I think these are important investments, but I think the biggest investment is actually in people. It's in human resources. It's great to have potentially have data. It's great to potentially have systems. But if you have those systems, if you have, for example, those EMRs, and you don't have the people that can operate them, or and in fact, an EMR in the first moments, it's often adds to the workload of a physician, right? Previously I could write very quickly. Now I need to type or code something into the computer, or maybe I need an assistant to help me enter the data into this new application. So sometimes systems also create some resistance when they are introduced. So a very important aspect is the human aspect, investment in enabling the professionals in using those solutions. But the payoff, it's not immediate, it's not obviously, it's not clear. except when, for example, a pandemic happens. But yeah, little by little, of course, those investments pay off. For example, procedures that don't need to take place because the information is available, so the doctor doesn't need to repeat a procedure that some other, perhaps family doctor already made. Better treatments and more personalized and more oriented treatments, such as what Maria Clara was describing. That the technology is already there. The technology is already there to allow us to make more personalized, more like precision kind of medicine, if only the data allows us. So I think this crisis made it clear that the data is needed to have better responses to such pandemics and potential future crises like bacteria that are resistant to antibiotics, which is a looming issue as well in the future, and so on.
Great. Well, thank you very much. We are just about to open the session up to the participants for your questions. And so I'd like to remind you to go ahead and submit them either via the Q&A or by emailing meetings@thedialogue.org. But before we do that, I want to turn back to our speakers and give them a quick opportunity to address any of the comments that were made by their fellow panelists or anything else that they wanted to share with the group before we go directly into the Q&A. And Miguel, I think I'll start with you if that's okay.
Well, just perhaps that's one comment. I think everyone touched a little bit on that as well. Perhaps on the ability to share data. I think Charles touched on that and Maria Clara touched on that. So regulations, consent. I think that there has to be a lot of there must be some evolution in terms of consent management. Give power to the citizens, to the patients, and to decide how their data can be shared and how their data can be utilized. I don't know if anyone else wants to comment on that.
Does anyone else want to comment on that, or should we turn back to?
Yeah, I just wanted to pick up on the sort of the utilization of data and the transfer of data, and I see there was a comment raised in the questions as well about this sort of the privacy of data as well. I think we do have a challenge in many markets where legislation and regulation is running behind innovation and technology, and that is going to impact on what data can be shared. So I think there is a need for governments who are the custodian of the entire healthcare system to look at how they're going to make those necessary changes. There has been some rule bending, if I can call it, if that's the right way of putting it, during the COVID period. But even in the US, where there was some waivers over regulation made, the US, they're now pulling back those waivers. So we've got to put pressure on the regulators to advance the sort of the rules of engagement around data. Otherwise, it could hold back all of these really good intentions just because we're not on top of the regulation is not on top of the evolution, for example. Thanks.
And maybe just building on what Miguel and Charles just said, I would like to call everyone's attention on the patient and how that must be what calls us all to work together fast. The pandemic, as Charles just mentioned, showed us that we can move quickly when we do realize there is urgency. So should we wait until the next pandemic? I don't think so. I do hope that we realize with this pandemic that there are many barriers that we self-impose. But when we have the purpose clear, which is benefiting the patient, we can move quickly and collaboratively. So I hope we start today remembering that it's a patient who we are acting for. So just that, calling upon collaboration of all sectors and remembering that the patient is waiting.
Thank you very much for that important reminder. I am now going to try to pull together some of the questions that we're getting from the participants, both through the Q&A and also through the emails that are being sent. Thank you very much, Kate, for helping out with this. And we seem to be getting a lot of questions on a point that that Charles raised, which is the standards and regulations that are needed to improve access, use, sharing of health data, and how can these be adopted across Latin America and the Caribbean more efficiently. Questions about the policy interventions that are required, so on and so forth. Would any of our speakers care to comment a little bit on that particular topic?
Well, maybe I can start with perhaps the standards, and I see a question also on cross-border sharing as well. Certainly, standards will play a very important part. It used to be a very mixed, very, let's say, disorganized universe, but in the last few years, fortunately, things have been improving markedly. And I think almost all vendors of technology and solutions are slowly adopting and becoming more fitter with a certain number of standards. And well, the standards start on the medical codification side, right? On the terminology side. If there's a chance to adopt, coding terminologies for diagnosis, for example, that facilitates like ICD-10 and so on, that facilitate the exchange of data and making sure that we're talking about the same things. Terminologies for nomenclature like SNOMED and so on. So this is already a big help. And then in technical terms, there was also a number of standards for the exchange and storage of data, but more or less the market is indeed coalescing around HL7 FHIR is probably the most relevant standard currently. It's still relatively new, and it needs there's some room for development, but it's definitely becoming let's say the lingua franca to allow for the exchange of data. So it's a standard that has let's say it's quite easy to use and to leverage. So I would all advise FHIR and something called IHE profiles, so integrating the healthcare enterprise integration profiles, is something that I would advise everyone that is thinking about procuring a system, implementing a new system, or retrofitting an existing system to look at those standards, see how they can better make use of them, how can they implement them to make life easier. And perhaps just one just one last word. Regulations are, of course, extremely important. So there must be the ability to allow data to be shared or to be centralized in some way. In some cases, there isn't, right? So this needs to be there as well. So just one more comment. Sorry, it's for galvanizing this answer around cross-border examples. I would advise Thomas that asked this question to look at, for example, at what was done in Europe around EPSOS. That was a cross-border exchange of prescriptions, for example. And now there's a larger initiative in Europe called eHealth. That is exactly about that. How using again HL7 FHIR and the internet, something called the International Patient Summary. How can data be shared across borders between the different countries using, let's say, an instance of that standard?
Thank you very much. We also have a number of questions about privacy and trust, and whether whether there are examples that some of our speakers can offer in the region or other parts of the world where privacy concerns have been addressed well, that other countries could follow.
Yeah, I'll give this a sort of response a go. I'm trying to think of specific countries that I can give as a good example, and I don't think I can, because it's an evolution. I mean, the EU is probably one of the better ones to look at in terms of what their rules are, and you need to be aware of what the rules are when you're looking at how you're going to manage your privacy. So I think it's important to look at the best practice that's out there. However, I'm going to caveat that by saying some governments are adopting the best practice, but they may not be ready and the systems may not be in place. Now, I might be getting my countries wrong, but I'm pretty sure Ecuador has just implemented data protection and privacy rules that align directly to the EU. So the questions we've got back from clients is, we're not ready. What does this mean? How do we do it? So again, as much as I've said that rules fall behind innovation, we are seeing some countries knee-jerk, understandably, to do the right thing. So I think it comes back to a point Miguel made as well, is when you're making that investment, make sure you're working with vendors that know the rules and their systems have been set up correctly and don't give you a problem down the line. And we have noticed occasionally when we've been looking at making investments into the providers, they're very naive when it comes to what the actual rules are. And if that's not addressed correctly, it could hurt you as a provider or a purchaser, or you know, even in academia, if you've got a solution that hasn't been aligned to the best practice rules. I'll keep trying to think of a country that I can think of is doing it right, but it's unfortunately it's a very fluid sort of very fluid issue. Thanks.
Well, I don't mean to keep putting you on the spot, but I will say we did get a question about the role of international organizations to boost the digital health agenda in Latin America and the Caribbean. And certainly I think, Charles, you're uniquely positioned to tackle that question. But I also, if Maria Clara and Miguel would like to comment on that as well, please do.
Yeah, I'll give a quick response. I mean, I think from a World Bank perspective, currently within the World Bank, there is a digital health initiative that's looking at certain countries, the evolution of digital health and what it means. So out of that work, there will be to help identify and demonstrate to governments what they should or should not be doing. So so that is now being done within the World Bank. From us on the IFC perspective, because we're investors, I mean, when we make an investment into this type of technology, we're looking at it from a number of perspectives, particularly its relevance for the markets it's going to be deployed in, its commercial viability, of course. Can it serve multiple populations and not just a little bit of a silo? But is it designed correctly as well? So we do put a lot of emphasis on the sort of the design, the relevance, the backbone to that technology. And I was given an example the other day, and I wanted to raise it earlier, and so I'll use this as the segue just to highlight it, is cyber attacks. So recently, a lot of healthcare organizations in the US have been hit by cyber attacks, and some of them haven't been set up correctly, and it's taken them off. It's sort of taken them offline, if I can call it that. So again, it comes back to the sort of the fundamentals and awareness, if I can, and that's definitely something we're actively looking at. And whenever we're advising our clients on digital health solutions, we're giving them checklists of the things that they should be looking at. And it's not just about the investing in the solution. The first question is, do you have the IT architecture to actually take on board all of these issues? And is it sufficiently robust to be able to manage it? And picking up on the point Miguel made, yeah, the people issue. It's also a people issue as well. Do you have the right people in place to be able to manage it? But sorry, it's a bit of a long-winded answer, but yes. So we are looking at it, and it's something we're going to continue looking at, and we will give guidance on it. And I know, for example, the WHO is putting a lot of emphasis now on sort of digital health solutions and how to implement them. Thank you.
And maybe building on that, and I was going to mention the WHO, who has this of leveraging data and technology to improve the performance and the sustainability of healthcare systems. There are also other movements, actually. I don't know if you've heard about the City Cancer Challenge. So that was a movement initiated by the UICC, the Union Internationale contre le Cancer, and the World Economic Forum. And that movement looks to improve quality cancer care in cities. So at the moment, there are 9 cities across the world participating in Latin America. I remember there's a city in Colombia, a city in Brazil. And the objective, I mean, they do want to improve the quality of cancer care, but they do it through bringing the different stakeholders to the table. Again, private, public, academia, patient organizations. So I think this is on the agenda of several organizations and movements that work horizontally, not just one country. And I think this is a very important way of leveraging and sharing knowledge, and not having to start from scratch every time.
Thank you very much. We are getting close to the end of the session, and I wanted to make sure that we took the time to invite each of our speakers to share with us your final thoughts. And maybe we start with you, Miguel.
All right. Yeah, maybe I just press on the topic, last topic that I touched on. Yeah, please, to the governments, I would ask, plead that indeed look at regulations that allow for data to be shared, putting in places whatever controls are needed, of course, so that information and data may not be abused, giving control to the citizens, but that allows indeed for the collection of data, for the aggregation of data, for the analysis of data that can then save lives in the end. And this goes also in other aspects of regulation. So in many countries, we still need to see some things like remote consultations, for example, being considered medical acts, right, and being allowed and being actually incentivized, and also compensated, right? So whoever provides that kind of service, that in the end also gets rewarded and paid for the provision, that type of provision of care. But indeed, the regulations must be there to allow for this. And yeah, and again, reinforce, please, work with vendors and that follow international standards, that will make your life easier whenever you need to improve your data quality.
Thank you very much. Maria Clara?
Yes, thank you. And everything that has been said today is so important that I find it difficult to choose one aspect to stress, but I'm going to go for collaboration again, because the digital technological transformation of healthcare is a huge challenge, and we can only achieve it working together, and remembering that the patient is at the center. The patient is what we work for. So with that incentive, I trust that we can leave aside our differences and work together to benefit the patient. And remember that this will not only help the patient, but also healthcare systems to really be more sustainable, stop increasing costs, and be more resilient. Health should be seen as an investment and not a cost. So that's my final message.
Thank you very much. Charles, why don't we wrap it up with you?
Sure. Yeah, I'm going to try not to echo and repeat what's been said, because I agree with all of above. I mean, I think for me, the fundamental question is, what do you want digital health and data to do for your organization? And you must start from that premise. So don't adopt the knee-jerk reaction. Have a systems mindset to saying, how am I going to take the digital health? How am I going to take the need for more data? How am I going to approach it? And I'm repeating what I said earlier. How am I going to implement it? But I've got to be mindful of the people, the process, and the technology perspective. And then ultimately, for me, we need to get away from this silo mindset. So I said it earlier. I mean, when it comes to data, digital health can enable it, but we need to have this mindset that sharing is caring. Thank you.
Thank you very much. Unfortunately, we've run out of time. So I hope everyone will join me in thanking our speakers who generously shared their time and insights today. And on behalf of the rest of the panel, I definitely want to thank all of our online participants for your very thoughtful questions, which added a great deal to the quality of our discussions. And then finally, thank you, Michael. Thank you, Eric. Thank you, Kate, at the Inter-American Dialogue for making this terrific event possible. Michael, did anything to wrap us up? Or?
Well, I just want to thank you, Adrian, for your outstanding moderation, your great questions, and of course to our really superb speakers, Miguel, Maria Clara, and Charles, for sharing their expertise and their insights and very, very wise final thoughts. I think each of them really expressed it very, very well. This is clearly a major challenge. Hopefully the pandemic, and as awful as it's been, will be a wake-up call to really move in the kind of constructive directions that I think our panelists pointed to today. And we're going to be continuing to have more on this and other issues related to health policy that were covered in our task force report. And you know, this is obviously an important issue, and hopefully we'll be as successful in future events to get such first-rate moderators and speakers as well. So just to thank everybody again, and just hopefully everybody will stay well, safe and healthy, and hope we can count on you for future